As we said a little bit earlier, the doctor is in, and today's topic is breast cancer treatment options. And there are many choices, and it's important to understand all of the options in what is a very stressful time for a lot of people. So Dr. Scot Ackerman, one of the First Coast's leading oncologists, is here, as he is every Friday, to talk about the different treatment options. And so let's dive right into it. So what are some of the treatment options if somebody finds themselves to be diagnosed with breast cancer or knows somebody who might have breast cancer?
Thank you, Casey. Women have many more treatment options for breast cancer than they ever have had before. We see this in a lot of cancers as well, but with breast cancer more than others, there's been a lot more options, which makes it very confusing for women, and women are inundated with a lot of information and have a hard time making decisions. As our technology is evolving and we're improving treatment for cancers, we wind up causing more problems because we're providing many more options for people. In the old days, when a woman had breast cancer, she didn't have a whole lot of options. It was a mastectomy, maybe chemotherapy, maybe radiation, but it was pretty much a mastectomy for everybody. The goals for treatment are twofold for any cancer: to rid the body of the cancer and to prevent recurrence. And when we treat cancer, we do it with three modalities, mainly: surgery, chemotherapy, and what I do, radiation therapy. When women have breast cancer, almost every woman has some sort of surgery. It may just be a biopsy, or it may be a lumpectomy where we take out the tumor, or it may be a mastectomy. Also, we use chemotherapy, and chemotherapy, there's different options for chemotherapy. Chemotherapy is used to go throughout the body to eradicate cancer cells wherever they might be. Some chemotherapy treatments are longer than others, some are more intense than others, some are more mild than others. And with radiation, we provide radiation in a lot of women. If they have a lumpectomy, we may give radiation to minimize the chance of the tumor coming back in the breast. Even after a mastectomy, frequently we do radiation because we've identified certain women who are at high risk for local recurrence after a mastectomy. We give radiation there as well. And we also use radiation frequently in breast cancer when the tumor spread to other parts of the body to alleviate symptoms associated with that spread of the cancer to other parts of the body. In addition to those three main things, surgery, chemotherapy, and radiation therapy, we have some other things that don't really fit into that, but we kind of throw into the chemotherapy world. Things like hormonal therapy, tamoxifen, which blocks estrogen and other hormones from stimulating cancer cells. We have immunotherapies and targeted therapies. But I guess at the end of the day, the treatment is dependent upon the patient and her health, and also the type of breast cancer and the stage of breast cancer.
And so some of these treatment options, you have to do them one by, I guess, can they be combined is the question, these treatment options?
Well, one option leads to another option frequently. So any of the treatments, surgery and radiotherapy and chemotherapy, they're not mutually exclusive. And so when, if a woman is going to have a breast cancer surgery, the decision as to whether or not she will need chemotherapy is not based on whether or not what kind of surgery that she has. The decision for chemotherapy is based on what the findings are, what the tumor looks like, how aggressive it is, if it's spread to any parts of the body. So these are not mutually exclusive decisions. Almost all women, I said, will have surgery. They'll frequently followed by chemotherapy and radiation therapy. But there's options regarding the combination of these different kind of treatments. For instance, when a woman used to be women would have mastectomies, and we found that if you have a lumpectomy and then radiation, what we call breast conserving surgery, then we have the same low recurrence rate as doing a mastectomy. We do lumpectomy and radiation. And so that's the sort of thing that these options allow us to mix and match different treatments a lot more efficiently, and it gets more confusing for women because there's so many options.
So with all the different options out there, how does a woman determine what's best for her?
Well, first starts with a discussion with her physician about what her preferences are, what her goals are. Certainly her goal is being cured, but a lot of women go into their physician and say, listen, I just want to have a mastectomy. Take both my breasts off, I don't want to deal with it again. And a lot of other women are concerned about cosmetic outcome and more concerned about quality of life and those sort of things. And all these things come into place. So you need to have a discussion with your physician about your goals. Number two, the physician needs to take into consideration the stage of the cancer, the health of the patient, the aggressivity of the tumor, we have found now that it's more important when we discuss chemotherapy with women. We have found, we used to think that the way the tumor looked under the microscope, the size of it, how aggressive it looked under the microscope was very important, what we call the morphology of the tumor. What we have found now is that there are certain genes within the tumor that are more or a better prognosticator of outcome than the way the tumor looks itself. And so we're able to identify, we're able to target our therapy more precisely. We're able to identify more precisely which women need chemotherapy and which women don't need chemotherapy. And hence, we could tailor a treatment plan for the patient based on all these little, all these individual things, on the genetic makeup of the cancer.
So now with all of these advancements in technology, are you finding that the survival rates for people who find themselves diagnosed with cancer are getting better?
Yes, because we have more survivors than ever. Breast cancer, everywhere you look, wherever you go, you meet someone who's had breast cancer, and they're cancer survivors. It's not because we have more breast cancer, it's because more women are surviving breast cancer. So we have enhanced survivorship in breast cancer because of two reasons. The first and most important reason is breast cancer screening. And I cannot push this enough. 20, 30 years ago, women were not getting mammograms on a regular basis. Today, women have access to mammography like never before. Women are getting mammograms appropriately. As I've said with you on the show before, I recommend that women at the age of 40 get a mammogram annually after that, and women are. And because of that, we're diagnosing cancers at a very small, early stage, in stage 1, with a cure rate. The cure rate is 90%. And in addition to early detection, enhancing our survivorship, is these treatment advances, identifying which patients need chemotherapy. We used to think that certain tumors didn't need chemo, and now we're finding out that they do. And the chemotherapy has enhanced survivorship, has prevented women from developing spread of cancer and having recurrences. So it really is very, very hopeful and encouraging, all these advances we have, and the things that we're able to identify and determine what sort of treatments patients get. And so I'm very hopeful that patients who go through a diagnosis of breast cancer are going to have good outcomes and be survivors.